Did you know that many communities face challenges in accessing healthcare? Understanding referral systems can make a huge difference. Today, we'll dive into referral systems in Zambia, exploring their importance, challenges, and solutions. Referral systems connect different levels of healthcare. They ensure individuals receive the best care possible. In Zambia, these systems can face various challenges. Rural transportation issues, communication gaps, and limited resources can hinder care. Let's discuss the key factors affecting referral systems. First, we have technological factors. Electronic systems can greatly enhance communication. Next, process factors determine how effective and efficient referrals are. After that, organizational factors involve management and regulatory practices. Lastly, patient-centered factors focus on the needs of patients themselves. Now, let's look at challenges and solutions in Zambian referral systems. Transportation can be a significant barrier. Rural areas often have long distances to health centers. Community health volunteers can manage drug box systems to help. Communication gaps also exist. Connectivity between community and health facilities is weak. Using mobile technology for referrals offers a promising solution. Documentation issues impact care continuity. Missing vaccine cards can disrupt immunization. Implementing digital record systems, backed by paper solutions, is essential. Lastly, feedback loops are crucial for effective referrals. Referral providers often lack feedback. Structured feedback mechanisms in protocols can resolve this. An example of success in Zambia is the ZISSP program. This initiative placed specialists in provincial health offices. They provided technical support and mentoring. This approach strengthened relationships between communities and facilities. Now, let's explore case conferencing approaches. Case conferencing is a collaborative way for professionals to support individuals with complex needs. In Zambia, logistical planning is essential for effective case conferencing. Meetings must accommodate participants from various areas, even remote ones. Cultural competence also plays a vital role. Facilitators must respect different professional perspectives and community contexts during discussions. Clear decision-making protocols clarify how decisions are made. Follow-up mechanisms ensure that agreed actions are carried through. For example, in Rufunsa, the Faith for Transformation project successfully uses case conferencing. Faith leaders build support groups and referral systems to tackle issues like injustice and child exploitation. This approach leverages community structures, providing tailored solutions. Now, let's discuss information sharing with privacy safeguards. Sharing data across agencies is crucial yet must protect client confidentiality. Zambia's laws like the Electronic Communications and Transactions Act emphasize the importance of consent when processing personal data. Key principles guide effective information sharing. First, purpose limitation ensures information is shared only for specific, legitimate reasons. Next, data minimization means only necessary information is shared. Consent procedures must be clear, documenting client consent carefully. Special provisions for vulnerable populations are also essential. Finally, implementing security measures protects shared information. An example is Chebesakunda and Company, a Zambian law firm. Their privacy policy emphasizes confidentiality and security while recognizing the need to share information. To summarize, referral systems, case conferencing, and information sharing are interconnected in Zambia. Successful implementation requires addressing transportation, communication, and documentation challenges while ensuring privacy. Now it's your turn. Get involved. Share insights about improving referral systems in your community. Let's enhance healthcare access together.